Okay, now dementia, right? This is a word that I think all of us sort of have encountered outside of medical school, outside of residency, outside of wherever we are in our training process. Um, and it's often used incorrectly. So I want to make sure that we have the right medical definition here. So it's a generic term, it's an umbrella term for disorders that affect cognition, right? In any domain. We often think about it with memory, but it could be something like behavior, so severely that it impairs your daily function, right? So it sort of has to have that component that it has to impair daily function. And you can't better explain it by another medical or mental disorder, and it can't be something that's sort of always been there, right? So someone who's born with intellectual disability, gets all the way late in life, has no change ever to their intellectual ability, I wouldn't call that dementia, right? So it sort of has to be a loss of some of these things that we used to be able to do. Um, with exceptions that I'll go over, you should think about dementia as something that is gradual, right? Over years. Someone was functional and became non-functional slowly over a long, long period, right? So if someone was normal before they went into the hospital and then became impaired while in the hospital, dementia is not your answer. You should think about things like delirium. The single greatest risk factor for dementia is age. But I want to be very clear, because I also think this is something that you might have to educate some family members and friends about sometimes, that dementia is not a normal feature of aging. There are normal memory changes, language changes that happen with aging, but dementia, right, those changes that make it so significant that you can't live your life, is not a normal part of having more birthdays. Mohammed, is this different from delirium tremens? Yes. So delirium tremens is the word we use sort of in that later period in alcohol withdrawal, like that 48 to, and that's characterized by hallucinations, increased risk for seizures. Good thought, different type of delirium.